Okay, here we go. So the first thing I'm going to do is wash my hands before I enter the patient's room. Hello, Mr. Vernon. My name's Alexis, the nurse that will be doing an assessment on you today. How are you feeling?
Hi, Alexis. I'm feeling pretty good today.
That's good. Do you know where you are right now?
Yes, I'm in the doctor's office right now.
Okay. Do you know what day of the week it is?
Yep, it's Friday.
Perfect. And then do you know how many quarters are in a dollar?
There are 4 quarters and $1.
Okay, so the level of consciousness is the patient is alert and oriented ×3. Communication is even, as well as the speech and normal. And then also just upon looking at the patient, I can see that there's symmetry in the face. And then I would look at the head. So I'm going to look around your head, make sure that it's symmetrical, everything looks okay. I don't see any cuts or abrasions. And then after that, I'm going to palpate the sinuses. So I'm going to palpate the top sinuses in the bottom for any swelling, which I don't feel. And then from there, after looking at everything on face value, I'm going to then go to the eyes first. So this is my Snellen chart. Pretty basic there. But I would stand 6 feet away from the patient if I had the mini Snellen chart, or the 20 feet away, depending on the one that I would use. And I would just ask the patient, can you read the lowest line for me?
Yes. So A, B, C, D, and E.
So on my chart, that's 20/20 vision, which is good. And then after that, I'm going to just look at the conjunctiva. So I'm just going to pull my patient's eyelids down, have them look up for me as well. Everything looks good. It's like a opaque, dull white color, which is normal. And then from there, I'm just going to look to see if you have any lazy eyes or anything. So I'm going to do the cover-uncover test. So I'm going to cover one of my patient's eyes and tell them to look at my fan. And then I'm going to uncover it and see if one of the eyes moves, which it doesn't, so it means he doesn't have a lazy eye. Next, I'm going to do the visual fields. So I'm going to see, like with the fishbowl, can you tell me when you see my fingers?
I see now.
Okay.
Now.
Okay.
Now.
Okay, so that would be about normal for the peripherals. And then I'm also going to do the cardinal field of gaze. So I'm going to have you follow my finger while I make an H. Perfect. Okay, so he is following it fine, so that's good. Then I'm going to have you keep following my finger, and I'm going to check his convergence and accommodation, so that's good as well. And then I'm also going to check his pupils with my little light. And then see if they're pearl or not, which that one is, and this one is. So pupils are P-E-E-R-L-A, perla, which is good. And then with my equipment here, I'm going to check to see if there's a red reflex. So we'll just pretend that this is an eye tool, and I'm going to say that there is one, looking into it. So that's good as well. So then that's basically the eyes. And then after that, I'm going to go into the ears. So I'm going to first inspect both ears. I can use my light. Look for drainage or any lesions, which I don't see. Then I'm going to palpate them. Make sure I don't feel any bumps or anything like odd in that manner. Then I'm going to do the gross hearing test. So I'm going to whisper in my patient's ear, and he's going to tell me what he hears. Red.
Red.
Okay. Orange.
Orange.
Perfect. So he could hear good. And then I'm going to do the Rhine hearing test. So this will be my Rhine hearing equipment. So I would hit it and it would vibrate. And then I would place it on my patient's mastoid process. And then I would tell him to let me know once it goes away and he can't hear it anymore. You just say no.
I can't hear it anymore.
Okay, so I'm going to remove it, and then I'm going to ask him if he still hears it now, which he should.
Yep, I still hear it.
Okay, and then I'm going to do the same thing on the other side. Place it on the mastoid process. Let me know when you can't hear it anymore.
Can't hear it.
Okay, can you hear it now?
I can hear it now.
Good. So that's normal. And then after that, I'm going to take my fancy equipment, my otoscope, and I'm going to look in his ear, in his tympanic membrane, and I see that it is opaque in which is normal. And then on my patient's right side, I should be seeing the cone of light at 5 o'clock, which I do. And then I go to the other side, and on my patient's other side, I should be seeing the cone of light at 7 o'clock, which I do, which is good. So then from there, I'm going to inspect my patient's mouth, teeth, tongue, membranes by having them open their mouth. Can I see your teeth? And then I'm gonna have them look under their tongue as well. Perfect. And then from there, which everything looks normal, everything's there. Do you have any dentures or anything? Are those your original teeth?
Those are my original teeth.
Okay, that's good to know. I'm gonna look at the back of their throat as well, and at their uvula. And then I'm also going to make sure that their mucosa isn't dry, because then that could mean that they're dehydrated. So that's done. Now I'm going to look into their nose and look to see if their septum's deviated or they have any weird drainage. And then after that, I'm going to move into the actual like neck area. So I'm going to have my patient turn around for me. Or you could have just turned the chair. It's a rolling chair. That's okay. Okay, patient turns around. I'm going to feel the thyroid, which, oh, I can actually feel in this patient. And I'm going to have them swallow. Okay, and it seems to move normal. I don't feel any abnormal bumps, such as like a abnormal parathyroid or abnormal side glands of the thyroid, the main thyroid. So you can turn back around for me. Okay. And then after that, I'm going to feel the patient's facial lymph nodes. So there's quite a few. There's the preauricular, which is like right here, and the postauricular right there. Then you have the occipital back here, and I don't feel anything enlarged. And then you go into like the cervical chain. So you have the anterior cervical, then you have the posterior cervical, then you have the deep cervical. And then you have the supraclavicular, and then after that you have the tonsillar, so that's back here again. And then after that you have the submandibular, and then the submental, which is right here. So that's all of those. And then after that I would just do the specialty tests, but in this case I'm going to have my patient move over to a flat surface. So we're going to pause the video. Okay, now that I have my patient laying down, I'm going to hold my camera because I don't really have another place to really put it. I'm going to have my patient lay, and I'll tell them first I'm going to test for rebound tenderness. So I would go to the opposite side of where the appendix is, and I would press down and ask if they feel any pain.
No pain.
And then I would lift up and ask if they had any pain lifting up.
No pain.
Which if they had appendicitis, they would have pain lifting up. That's the point of the first test. And then I would test for cholecystitis. So basically that one's called the Murphy sign test. And I would go over towards the lower liver, which is where the gallbladder kind of sits. And I would try to find, feel, and palpate for it. And then I would press down. And at that point, have them breathe in. And if, as they were breathing in, if they were to feel pain, they would stop kind of mid-breath, and that would be a sign of cholecystitis. It would hurt as they were breathing in when I was pushing down on that. And then the last thing I would do is, well, you could actually sit up for this one, is the carpal tunnel test, and that one's called, that's called the Darkin test. And basically I have the patient hold their hands out, and I would feel for their middle nerve, and it should be like right here. And then I would press down on it, and I would have them like open and close their hand. You can open it. And then if they were to feel, and I'd ask them if they feel any numbness or tingling.
No numbness, no tingling.
Okay, and then I would do that on this hand too. I'd have them open and close their hand. And then do you feel any numbness or tingling?
No numbness or no tingling.
Okay, so that's good, because that means that if he did, he could have a possibility of having carpal tunnel. And I did the Durkin test because that one is the most the most accurate according to the book compared to the other ones. So that is my HEENT / specialized test assessment. Thank you, patient.
Thank you, Nurse Alexis.
You're welcome.